We're here with Claudia Ortiz. Claudia, we are piloting something new here on Nevada Week, and it's kind of taking somebody from the community that is related to the issue that we just covered on the show, and kind of getting some of their personal perspective of how they've been affected by whatever we had, the topic that we had on the show, or potentially you are doing something in advocacy work or community work that's related to it. So that's why we've had you, and I wanted to start with this. How we kind of came to know each other is kind of kismet, and our producer met you in the lobby of Vegas PBS. Tell us a little bit about that first interaction.
So I came in last Tuesday and was just handing out a business card and letting them know that, you know, I run the Butterfly Effect Foundation for Suicide Prevention, and kind of told her a little bit about our support groups. And she's like, oh, we're doing this interview on school safety, and I'm like, oh, okay, that'd be really nice. And I just kind of told her my story, and it led it to where we are now.
Yeah, can you explain a little bit of what the Butterfly Effect Foundation is?
Well, the Butterfly Effect Foundation wants to bring awareness and prevention to our teens and educate our parents on suicide, and especially our parents, our adults, who are very blindfolded about suicide.
And you started this foundation on your own, is that correct?
I started this on my own because I lost my daughter by suicide December of 2018. So in being in the darkest moment of my life, I needed to find a purpose to my life, and it just changed my world and the way I think and see things. And my son came with this idea about peer-to-peer counseling at school. He started doing it, and that's when the idea came to me.
Now, you were able to watch the show that we just recorded, and we talked about school safety on a lot of different levels, one of which we did touch upon was bullying and then parental communication, but also communication between teachers and parents and principals and things like that. I mean, how does that relate to your personal story then of where your daughter was?
Well, she was being bullied at school, and I didn't know about it. So I believe that's where the communication comes in from schools to our students and to our parents. If we're not communicating these things to our parents, how are we gonna be able to help or intervene or find the kind of help they need to deal with bullying or anything else going on in school? And
you didn't know, so it was an after the fact. And when you're talking to educators and you're talking to the principal and even some of the students in the classes, I mean, did you get a sense of why this wasn't communicated to you? I
feel that they're not very well trained to deal with mental illness. When it comes to suicide and bullying, I just feel that there isn't a lot of training for our teachers and staffs.
And that was one of the things we covered on the show, is that we're looking at getting more social workers in classes. The ratios are definitely off there, and more psychologists also for school districts as well. So tell us a little bit about the Butterfly Effect Foundation, then what is it exactly that you're doing?
Well, I'm starting support groups, like I said, for suicide survivors and their families, for teens and adults. Everybody's welcome to come out. But my ultimate goal is to be able to become an advocate on mental health and suicide awareness. The other thing I plan on working along the way is bringing this awareness to our schools, to where we can give our students tools and let them know this is what maybe a person with, I don't know, suicidal thoughts might be feeling or dealing with. We don't know what mental health looks like, but if we know the right symptoms and we know what the target, we'll be able to help more students. So that's my very, very ultimate goal.
And you said survivors. So are you working with teens and family members that have had a suicide in their family as well?
Actually, I have not really heard from a lot of suicide survivors. I've tried to pass out a lot of flyers and get a hold of our community. I've gone to libraries, I've gone to multiple places, but I feel that when it comes to suicide, people are very stigmatized about it and will not talk about it.
Yeah.
They will push you away and will not refer you or not talk, you know.
Yeah.
So you have to talk to the right people sometimes and have them be able to spread the word and let them know we're here. You know, you're not alone. There's other people that are going through the same thing you are.
And do you find with the ones that you have been able to connect with then, is it kind of after they kind of get over that and understand that they become advocates too, and they understand the awareness aspect of this?
Yes. As far as me, I started doing this because, like I said, my daughter. And it's led me to want to become an advocate, to dedicate myself to bring this awareness and teach others to be able to help those with mental illnesses.
Yeah.
And bring them the right help and direct them to the correct mental facilities or any resources there might be for them.
And just in the work that you've done briefly, and I know your nonprofit's new, but when you look at just the whole spectrum here, and let's talk about parents, your parent as well, what skills do you see that we as parents are missing that would help us not only identify maybe some of the signs, but also communicate those if we're not necessarily dealing with somebody with our own family, but maybe somebody outside our family that we see as having those signs? What do you think we're missing?
Communication. A lot of communication. Parents are too busy being parents. We're too busy being adults sometimes. And we just dismiss. We tend to dismiss the little things that our kids want to show us or talk about the day. You know, how was your day? And we don't do that sometimes. I've experienced it. I was very busy with work, and you know, even at my son now tells me, "Mom, you've changed so much." Yes, all these trainings have helped me, and communicating with them is the key word.
Yeah. Having
more communication with our kids.
Yeah, and I think in addition to communication, the awareness that you're trying to bring too of exactly what you said, it's a great thing for us all as parents or family members to remember, is that we live these busy lives. We just need to slow down a little bit and look at maybe some of the signs that we're not necessarily seeing.
Self-care.
Yeah, absolutely. Claudia, thank you so much for being here. We really appreciate it.
Thank you so much for having me.
Yeah.